Hello, I'm Harris Pastides, President of the University of South Carolina. I'm here today to tell you about a very valuable resource that is being used in educating our future nurses, the Clinical Simulation Lab at USC. Ours is one of only 5 BSN programs in the nation selected to participate in an important study to determine best practices for simulation education. The purpose and structure of the study, what we think the findings will reveal, your thoughts on the study, and the simulation itself will all enhance the learning experience. Now let's take a more detailed look at what our lab offers.
Hi, I'm Erin McKinney. I'm the director of the Clinical Simulation Lab here in the College of Nursing. Today I'm going to show you around so you can get an idea of what kind of things we do here. But first I'd like to talk about some of the firsts that the College of Nursing has had in the state. First accredited baccalaureate degree program. First Doctor of Nursing Practice program. First graduate nursing degree program. First PhD program. First Sigma Theta Tau chapter. First NIH-funded nursing research grant. First NIH-funded Center for Research Excellence. First Center for Nursing Leadership. First Nursing Leader Fellowship Program. Greater than 90% passing rate on nursing boards. And now, what you're really probably interested in is how this lab works for our student nurses. We're really excited about it, and after you see it, I think you will be too. Thanks for joining us.
Hi, Mr. Anderson. How are you doing today?
Hi, Mr. Anderson.
I'm not doing so well.
You're not doing so well? What's going on?
My chest hurts.
Can I get you to say your name for me?
It's Trey Anderson,
And your date of birth?
October 30th, 19...
Mr. Anderson?
Mr. Anderson?
Mr. Anderson? All right, call a code. Locating the xiphoid process, 2 to 3 fingers up. Starting compressions. 2, 3,
Putting the pads on. One under right clavicle. One on under his left nipple. Plugging pads into the defibrillator. Okay, initiating shock. I'm clear, you're clear, everybody's clear. Shocking.
Shock delivered.
He's in normal rhythm.
The mannequins, they're so neat. They'll talk to you, they'll cry, they have IVs going, they'll cough. You can listen to their breath sounds, you can take their blood pressure, and it's just really an interesting experience.
This is SimMan 3G. He is one of our high-fidelity mannequins. His vital signs are changed with a laptop. He blinks. His pupils react to light, so the students can actually use a pen light and his pupils will constrict. He has normal heart sounds, or they can be abnormal. He has a respiratory rate that can be increased or decreased. We can push IV medications through his IV port right here. His mouth will glow blue, and that lets the student know that he's cyanotic or doesn't have enough oxygen, so they can apply an oxygen mask. And in the program, we'll click that they've applied oxygen and he'll improve. He has bowel sounds. You can put a Foley catheter into his bladder and we can have a fake urine return. He has pulses everywhere, his feet, behind his knees, at his wrist, at his neck. He's as human can be.
This simulation lab, I just think is so realistic. Over the years you hear about, you have mannequins to practice with that, you can give an injection, but these do so much. You have ones that birth babies, and now especially since they're able to talk to you through them, it really prepares you.
Now we're in Noelle's room. She's the mannequin that everybody wants to see. She actually gives birth. Her baby is baby Hal. And the students, prior to going to labor and delivery, will frequently come in for a scenario to watch a birth. It's as close to the real thing as you can get, and it helps the students know where they can stand, what they need to do, and decreases anxiety once they see the real thing.
We also had a pediatric mannequin, which was fun because you have a lot of the adult patients and the adult mannequins, but you don't always get experience with the pediatric patients. So it was really cool to have a simulation with a pediatric-sized patient and working on that.
This is Sim Baby. He's our newest addition and really one of the students' favorite simulators. We use him for pediatrics mostly, and he has allowed us to run labor and delivery scenario in Noel's room at the same time that we're running pediatric scenario in Sim Baby's room, which is really nice. He is high fidelity. He's as fancy as any of the large simulators, and the students love getting some hands-on with a baby before they go in the clinical setting, because some of them really haven't had an opportunity to hold babies and handle them much.
This is a time to make your mistakes. You have all the chances. They give you a lot of opportunities on these mannequin patients, and then once you get in the real world, you feel a lot more comfortable because you've done it before.
The nursing program is awesome. It's hard, it's difficult, but if you have the determination and willingness to get through it, you'll have your bumps in the road and your ups and downs, but it's definitely worth it in the end. You have a good degree, good job security, and you meet a lot of new people and you're able to help people, and that's the biggest thing. That's why I wanted to be a nurse, is to help people.
Well, I've introduced you to several of our mannequins so you have an idea of what they look like. You may have questions after this presentation, and we have the contact information provided, and we hope to hear from you and maybe a visits in your future. Thanks for visiting. Bye-bye.